We're now going to start our panel discussion about urban environmental challenges, and I'm going to hand it off to Raquel Jimenez, a doctoral student in the Department of Environmental Health, and Luca Morreale, a PhD student in the Department of Earth and Environment, to introduce our speakers.
Thanks for that introduction, Pam. For anyone who has joined recently, I want to welcome you to the BU Urban Symposium. This is going to be the panel discussion of it, a piece that I'm particularly excited for because I think it emphasizes and highlights one of my favorite pieces of the urban program, which is the emphasis beyond what you would find in maybe a normal or your average PhD program on working with, learning from, and co-generating research and applications with organizations that span well beyond academia. And so I'm really excited to hear from some of our panelists. I will start by introducing our first panelist. But before I do that, let me just quickly go over the format. We'll do a couple of rounds of questions from us, the moderators, and then we will open it up to questions and answers from the whole group. Very similarly to what we just did, please put your questions in the chat box, and then they will be collated and curated by one of our moderators. So thank you very much. With that, I'd like to welcome one of our first panelists. Councillor Quinton Zondervan is on his second term of the Cambridge City Council and is a software engineer and a tech entrepreneur who helped launch several companies in software, biotech, clean tech, and healthcare. Quinton is a committed environmentalist whose work on the council focuses on sustainable transportation, climate change, and affordable housing. Quinton spent a decade advising the City of Cambridge on climate mitigation and adaptation policy through his appointment on the Climate Protection Action Committee. And in 2013, he co-authored the successful Net Zero zoning petition. Previously, Quinton served as president and board chair of Green Cambridge, a nonprofit dedicated to taking climate action and enhancing Cambridge's sustainability. Quinton also participated in our program's Urban Governance Workshop Series this year for a roundtable on how city councilors use research and community input to make decisions alongside Boston City Councilor Michelle Wu. He is currently in conversation with one of our trainees, Jess Wright, for her urban internship this summer on natural gas policy. So with that, I'd like to welcome Quinton back to the BU Urban program.
So our second panelist today is Dr. Rachel Huxley. She is the Director of Knowledge and Learning at C40 Cities, a network of 96 global cities taking bold climate action. Rachel has been with C40 for over 3 years, during which time she has developed and led research on the co-benefits of and barriers to urban climate action. Before joining C40, Rachel was Chief Executive of Peterborough Environment City Trust, advancing work on sustainable behavior change and working with city partners to develop a sustainable city plan. Rachel also established and led the Sustainable City Network, an informal network of leading UK cities to enable the sharing of best practices and urban challenges. This past summer, Rachel hosted one of our urban trainees, our own Lindsay Butler, for her urban internship on city climate change policy and its effects on human health. Rachel also recently completed a PhD of her own, on sustainable cities at the University of Leeds. So congratulations, Dr. Huxley, well done. Also joining us today is Newsha Ghaeli. She is the president and co-founder of Biobot Analytics, a startup based in Somerville that helps cities learn about population health by measuring indicators from wastewater. Biobot recently expanded from tackling the opioid epidemic to addressing COVID-19 by measuring analytes associated with the virus in sewage networks. Prior to Biobot, Newsha was an instructor in the MIT Department of Urban Studies and Planning and a fellow at MIT Sensible City Lab, where she worked on applications such as Treepedia, an open source tool to evaluate and compare tree canopies in cities throughout the world. Trained as an architect, Newsha worked with the World Economic Forum's Council on Future of Cities, the United Nations Climate Change Summit, and the US Department of Energy. This spring, Newsha and her team at Biobot hosted an urban trainee, David Reynolds, who just presented a few minutes ago, for his urban internship, and he is currently continuing to work with Biobot on their COVID-19 work. Once again, I'd like to welcome and thank you all for being here today. I am very excited to get the conversation going, so we'll start by asking our panelists a few questions, and then we're going to open up for questions from the audience. So the first question for our panelists. Each one of you comes from a different type of institution, so government, NGO, and private sector. How would you describe your approach to tackling urban environmental challenges, and in what ways is that unique to your sector? Starting with Newsha, Rachel, and Quinton. And just so that we can have ample time for discussion, please try to keep your answers between 2 to 3 minutes. Newsha.
Great. Well, thank you so much for having me. Hi, everybody. I would like to just correct one thing in the intro, just, you know, given that we have Quinton, Councilmember Quinton here with us, we are now actually headquartered in Cambridge. So we moved 2 weeks ago from Somerville to Cambridge. So we are officially back to our roots in Cambridge, Massachusetts. So yeah, addressing your question, you know, what's our approach to tackling urban environments and what do we think is unique to our work? So at Biobot, you know, and you touched on the fact that prior to COVID, our application was looking at opioid consumption and understanding opioid consumption in cities. So I would say at Biobot, fundamentally what we do is leverage technology to transform sewage into a public health observatory. So at the company, we see sewage as a data asset that can actually help us address you know, all sorts of pressing urban challenges with respect to health. And so I think one of the fundamental aspects of our approach is that we are building a responsive tool, a tool that's responsive to the evolving and changing nature of urban challenges. And I think when working specifically around urban challenges, environmental and other, it's very important for us to be responsive because our urban systems and cities are so complex and it's never a one size fits all. And so especially I think from the private sector approach, being very responsive is important. And that's sort of the shift that we've seen in the company right now. You know, up until 2 or 3 months ago, the opioid epidemic was the biggest public health crisis in the US. And so for the last 2 years, our focus was primarily on that. And all of a sudden, you know, in February and March, like everything turned upside down and all of the folks that we worked directly with had completely shifted their focus onto COVID-19. And as a society, you know, with that health lens, everything shifted to COVID-19. And so we knew that as a company, we had to respond. And this was exactly why we built a flexible technology like this. So yeah, I'll stop there and looking forward to the conversation.
Thank you. Now we're going to hear from Rachel.
Okay, sorry, I couldn't unmute for ages. It was telling me the host needed to unmute me. So I was just typing that into the chat box, but I don't need to. Great, thank you. Really nice to be here and participate, meet you all. As per the intro, we were really lucky enough to have Lindsay help us out last minute, time flies, and that was so incredibly valuable that yeah, it was just fantastic. So in terms of our approach to tackling urban environmental challenges, we're a mayoral-led network. So as per the intro, we consist of 96 cities globally. But we were set up by Ken Livingstone, the then Mayor of London, who invited other mayors to join him in a sort of urban-led, city-led effort to tackle climate change in response to pretty poor efforts from national government. So we're led by mayors for mayors. So that's the kind of biggest fundamental about any of our challenges. Our theory of change is around leadership. So that commitment to a vision around compatible climate safe cities. And that's the first thing that we start with. And then in terms of the second, it's around planning and setting targets. And then thirdly, around peer-to-peer learning. So the idea that cities, obviously all cities are unique, but there are a lot of similarities and they can share, they're facing the same challenges and they can share solutions. So we have a lot of ways to share to accelerate the spread of solutions and innovation. And that's really fundamental. It's kind of the beating heart of C40, if you like. The fourth element of our theory of change is around barriers. So we know that this isn't easy. If it was, we'd have done it by now. So how can we support our cities when they make bold commitments and take bold action in terms of tackling those barriers? And the fifth part of our theory of change is around thought leadership. So what's coming next? What's on the horizon? Because we need to be one step ahead. And I guess a couple of other things to say about our approach. We're a data-driven organisation that reflects, I suppose, just our sort of situation and context, but also some of the people who've been involved in the past. So for those of you that don't know, Bloomberg was chair of C40 when he was mayor of New York, and his famous phrase, "In God we trust, everyone else bring me data," has really had a big impact on us as an organisation. So very data driven. We're also very political because we are a mayor's-led network. And so we need to do science at the speed of politics, and we're grounded in the kind of messy reality and the art form of blending science and politics, which is wonderfully challenging. Of course, we're impact oriented and we're mission driven. So fully supportive of the Paris Agreement, you know, needing to look at climate mitigation around 1.5 degrees, adaptation to at least 3 degrees, and with that equitable climate action that's inclusive of all and fair. And so, you know, like many NGOs, we've got a sort of, we're tackling a bold challenge and we've got a big ambition, not necessarily because we want it to be quite so big of a challenge, but because it has to be, you know, that's the climate situation that we're facing. So in terms of whether that's how, you know, how unique that is to the NGO sector and how reflective C40 is of the NGO sector, I mean, obviously we're a non-profit, that does affect how we work. We don't charge our cities to be members, not in terms of finance anyway. We do have participation standards, so we do ask them to kind of actively set themselves and then live up to a set of standards. Targets around action and impact, and that's fairly standard of the NGO sector. So we have to justify our worth based on the impact that we have. And I would say that the mayoral-led aspect I talked about, I think also reflects a fairly typical NGO sector approach around sort of collective, collaborative, co-design, you know, strong on stakeholder ownership. And finally, the mission approach I talked about is typical, you know, having a mission-oriented approach in the NGO sector. But I would say whilst all of those are typical of the NGO sector, I don't think they're unique to it at all. And I think that's my time.
Okay, thank you so much, Rachel. Now let's hear for Quinton.
Thank you. Unmuting is taking a little while. Let me start by welcoming Newsha back to Cambridge. Glad to have you. I did look at that some of those early studies that you guys published. It was very interesting, and definitely look forward to more results from that. So in terms of the question, you know, I've worked in the private sector at NGOs and now as a representative in government. And I would say that one of the things that makes being in the government really unique is that I have to represent everybody. And so I can't be laser focused just on environmental issues. And when I am focusing on environmental issues, I still have to broaden them to make sure that we are including everyone and that we're really being equitable. And that means looking at the environmental issue, not just at how does it impact everyone, but also how does it impact specific people and populations differently. So for example, we recently did a study of our tree canopy and concluded that our tree canopy is declining across the city, which is obviously a big problem, and we're now looking at different strategies to counteract it. But we're also looking at where is the tree canopy already the lowest. And of course, that happens to be in our poorest neighborhoods, our densest neighborhoods, and the neighborhoods that are traditionally where our Black and Brown communities live in the city. And so as we think about responding to that, how do we make sure that we're not just improving the canopy across the city, but that we're really targeting those areas where traditionally they have been underserved and their canopy is the lowest in our city. So I think that's one of the aspects that makes it unique, I think, to be in government, is to really have that lens of how do we serve everyone, and then how do we do justice and serve the people who are the most vulnerable, who have been left behind the most, in a more equitable manner.
That's great. Thank you so much, Quinton. And just, I wanted to remind before we go to our next question, please keep your answers down to 2 to 3 minutes so that we can have enough time for the discussion.
And I will ask the second question. This was originally a two-part question, and it was, some of you already covered the first part. So if you already covered the first part, just focus on the second part. So our question is, how have your urban environmental priorities shifted in the COVID-19 era? As I said, some have already talked about it, but kind of focusing on the second part, as we look ahead, where should urban environmental researchers focus their attention next? You know, we kind of have this moment where we're taking a step back and all focusing on COVID, but coming out of this, there will still remain the problems that were there before. So if you can talk about how you're thinking about that and where you think perhaps we should be focusing our efforts, that would be great. And we'll go in the same order. So starting off with Newsha, thank you.
Okay, great. Yeah, so I already answered the first part of that, so I'll just jump into the second part. And I'll make it super quick. I mean, to me, well, first of all, to underscore sort of what I was getting at in my first question, I think that we need to be responsive to the needs of government as well as city dwellers, so the people that actually live in the cities and use the cities that we build and manage. But personally, I think that, you know, some of the biggest issues today and what will continue being the biggest issues over the next few decades are definitely climate, health, and social disparities. I think, you know, with health, yes, right now it's COVID, but even coming out of this, I think our COVID has just illustrated the unpreparedness of our public health infrastructures, both here, but also internationally, globally. And it's also highlighted how susceptible and vulnerable we are in this era of globalization and increased urban density. Disease is going to be a big thing that we need to learn how to mitigate, I think, effectively. With climate, I mean, I think sort of also just enough said, it's everywhere. And I still think that there's a lot of work to be done for us to take climate mitigation strategies a lot more seriously and implement them. And there's great work that's being led by groups like, you know, C40 and other organizations. And so I think continued emphasis on climate. And then social disparities, I think, is one that is becoming more and more highlighted over the last maybe decade and over the last few years particularly. And I think that that's another area where a lot of these other issues like health and climate, I think, exacerbate the situation with social disparities. But I think as a community, in thinking about how to solve urban challenges, that's going to be one of the biggest ones, at least here in America.
Great, thank you very much for that, Newsha. And then we'll pass it over to Rachel. Same questions.
Okay, great, thanks. So yeah, brilliant question. I mean, similar to what Newsha said before, COVID's kind of turned C40 sort of world upside down along with everyone else's. So we've really pivoted to supporting mayors on the COVID issue. And what we're seeing is a shift from a very traditional kind of sectoral approach in our cities around energy, buildings, transport, waste as the kind of big sectors to focus on with regards to GHG emissions. to really talking and framing everything around health, vulnerability and equity, and jobs and economy. So our cities are not thinking in sector silos at the moment, and probably they were all often having those conversations, but their conversations with us were very much sectoral, and now, you know, they're really not. With one clear exception, and that's transport. So transport really is being talked about, mass transit, walking and cycling, space, private vehicles, for all of the reasons that I'm sure are kind of clear to everyone. Our cities are still thinking about sustainable and equitable change. Maybe we're lucky to work with a cohort that are very committed and leading in that sense, but we're not seeing a kind of, we can't afford to think about climate at the moment. We're seeing a sort of double down on commitment to tackling the health crisis and the climate crisis. And we're also, you know, our cities are thinking for climate, of course, but for environment, society and economy writ large. And what that means for research, I mean, in its simplest terms, our cities are hungry to understand what they need to do. And, you know, we're seeing a lot of that emerge already, and it's not necessarily radically different from what we were sort of saying before, but are there any key kind of gaps and questions that need addressing? And that will kind of emerge as the dust settles on all of the kind of fairly rapid what we need to do for post-COVID recovery info that's coming out. But, you know, particularly what does a more sustainable and healthy economy and or city look like? You know, the link between environment and health, I think, is sort of, people are used to thinking about that, but also the link between economy and society and health, which you're much more au fait with than me, I'm sure. So that was what. Why is going to be critical. So we have less money and more that we need to do. So we're going to have to make an incredibly strong argument for sustainable recovery as opposed to business as usual. And health is a critical part of that argument. So the link between air quality and COVID, I think, is very compelling. The more we can evidence that, and also leveraging, I think someone was talking about it earlier as well, the kind of real world data during lockdown that can show, look, this is the alternative and what it would mean for all of our health.
Yeah. Great, thank you so much, Rachel. And last but not least, we'll throw it over to Quinton.
Thank you. Yeah, just to build off what the previous speakers have said, and I completely agree. I think, you know, obviously our focus has shifted entirely to COVID-19 in the government, but as we start to come out of the immediate pandemic emergency, we'll pivot back towards, at least I will, prioritizing environmental efforts. But really the key that we need to focus on is the economy, because ultimately all of these challenges that we're dealing with, whether it's climate change, air pollution, ocean pollution, whatever you think about, it's all part of our economy that's generating these challenges. And as we rethink our economy, we have to take advantage of that opportunity to say, we really need to do things in the same way that we were before. So just as an example, you know, in Cambridge, we have a lot of office buildings and a lot of people commute into work every day. And, you know, we have a somewhat decent public transit infrastructure, but we still also have a lot of vehicles coming in to the city every day. Now with COVID-19, one of the things that we hopefully have learned is that we can actually do a lot of that office work without driving people to office buildings every day. Some people are still going to have to come in, even for office work, but obviously for more physical work. But if we can use this experience to change our behavior and say, you know, those people who can work from home, let's facilitate that, let's make that more of the norm so that we reduce pollution, we reduce traffic, we reduce fossil fuel combustion, and, you know, take that pattern and apply it to our entire economy and see how we can rework and rethink our economy so that we're more in sync with natural processes and that we're doing hopefully less damage to the environment and the climate.
Great. Thank you, Quinton, and thank you all for such wonderful answers to that. I am now going to toss it over to Katharine Lusk, who is going to lead the audience question and answer section. A bit about Katharine. Katharine Lusk is the co-director of BU's Initiative on Cities, a university-wide research center which catalyzes urban research and leads an annual survey of US mayors and runs experiential learning programs which connect faculty and students with cities. Katharine formerly served as a policy advisor to the late Boston mayor, Tom Menino, where she led his work to make Boston the first city in the country to achieve pay equity for women. BU Urban is proud to partner with the Initiative on Cities for our Urban Governance Workshop series, and we consider Katharine a critical component of our program's success. Katharine, take it away.
Thank you. Thank you, everyone. Thank you, Newsha and Rachel and Quinton thus far. I'm going to close it out with the next 20 minutes or so of questions, and I see some that are rolling in as well in the Zoom chat. So a reminder to folks to please pose your questions and I'll try to get to them. The first one is actually coming from Evan. All of you touched on data and the important role of data, but data, we're also entering an era of potential widespread distrust of data and experts. And in some cases, distrust of government, certainly from certain corners of the population. And I'm curious how you, how you deal with the changing valuation of data in your work. And I want you to complement that by saying not just the changing valuation of data, but also how you think about data. What is data? Are we thinking of data in the sort of big data sense of quantitative data? And how do you marry that with qualitative data, anecdote, narrative, and some of the other ways that we can sort of make sense of sort of current crises and public health challenges. And Newsha, I'd love to start with you because you told us, I think you didn't quite say, poop is data, but you almost got there. So effluent is data. You used more eloquent terms, but which I think is fascinating, right? Because it's both a great equalizer and it's uniform across communities. It exists everywhere. But I'm really curious, how do you think about that sort of changing valuation of data and the rigor with which you approach your work and the need for data, but also how do you define data in the sort of qualitative or quantitative sense?
Mm-hmm. Yeah, thank you. This is a great question. And I almost also want to tap David Reynolds, who's here because he works with all the data at Biobot. David is still working with us on a lot of our data problems. But I think that's a great question around how do we think about data, both qualitative data and quantitative data, and what does it mean? So, just as an anecdote, or when we first launched our opioid product, so we were measuring the concentration of about 30 different opioid and other illicit drug related substances, chemicals, metabolites that are excreted in urine and collected in stool, to understand true consumption in neighborhoods. And actually the problem, so to speak, that we were solving was a data problem in government. It was that we felt that looking at overdose deaths or non-fatal overdoses wasn't the correct metric to guide a city's public health response to the opioid epidemic, because the data, not only is it reactive, in the sense that these individuals are already they're at a very specific place within the life cycle of somebody who suffers from substance use disorder. But it also takes a long time for us to get this data back, map it, and make decisions off of it. And we felt that looking at wastewater was more proactive. But another thing to highlight that you just touched on was that a lot of our data systems rely on very biased approaches to collecting information. So, when we look at overdoses, they tend to skew towards a certain demographic of the population. They tend to capture more underrepresented communities. We see a lot of folks due to, let's say, perceived either like cultural stigma or fear of law enforcement, don't call 911 when somebody in their community overdoses to reach out for help. So the data sets that we have are skewed towards folks who are self-selecting in some cases, and around COVID as well. It's individuals who feel ill and who self-select to go to the doctors and get treated. Whereas in sewage, it's unbiased, and everybody has a voice in wastewater, and it captures information on everyone. And so I think what's really important in communicating a lot of these nuances around differences in the types of information that we use to make decisions is educating folks. And that's one thing that as a company, we've definitely had to think about and come up with a framework on, is how do we educate people on how our data is different from what they currently have available. So this is like public health departments, decision makers, the general public in a lot of cases. How is our data different? What additional information is it providing? And what are the limitations of our data? Obviously, you know, when you look at wastewater, this should not be looked at as a clinical reading of, let's say, the number of heroin doses in your community or the number of COVID patients that exist in a community. So really being careful around the messaging and the narratives around what can our data tell you and what are the limitations, and being very upfront and transparent about that. And being very clear around when the data is best used as a qualitative tool versus a quantitative tool, because we also see that a lot in the work that we do.
I want to go to Quinton next. Quinton, I see you've posted a spreadsheet which I can't open, and I want to pose the same question to you. You know, it feels like we live in a world where data is necessary but not sufficient, particularly in government. And I'm curious how you think about data and gather insight and data from the community in your decision making. And then I'm going to pose, Rachel, I'm going to pose a different question to you, because there's a lot of questions coming in. I'm going to pose a different question to you. You can still think about this if you want to. Quinton. Oh, muted. Oh. Pam, do you need to, oh, there we go. Pam, it might be, do you mind maybe leaving the speakers, all the speakers unmuted? That might just be easier for the purposes of rapid fire questions.
They are unmuted, so hopefully it stays that way. If not, it's changing on its own.
Thank you so much. Quinton.
Thank you. I think we have to really democratize data, and that's what I try to do. I'm not a data scientist. I'm a computer scientist, so I've looked at spreadsheets and I know my way around, but you know, I try to bring a kind of slightly more layperson perspective to it, and see what's the data telling me, and what can I get out of it. So, you know, that spreadsheet I shared with you is a bunch of data that I've been collecting, mostly from the city of Cambridge, and trying to read what it's telling us. You know, so for example, if you look at that data and you correlate it with our population demographics, we see that Black people in our community have an infection rate of about 3 times white people in our community. And that's pretty concerning, given that, you know, Black people represent 11% of our population. So you wouldn't expect such a huge disparity. And then if you look a little deeper and you take out the nursing home population, which has a lot of our COVID patients, it's actually 4 times in the broader community, 4 times the infection rate among Blacks and 2 times among Hispanics compared to whites. So that's telling us what, you know, we see across the country, that there's clear disparate impacts here of this pandemic. And of course, it's not surprising, but it is concerning. And then begs the question, why, right? What's the underlying dynamics that are causing that disparity? And then what are we going to do about it? And so really, you know, I mean, I think Newsha spoke to this very well, that a lot of the data is coming from a place of bias and systemic bias and racism in the past. And so part of the distrust of the data, the government, the experts is, well, you've been telling us a just so story for, you know, 300 years, or pick your time window, so why should we believe you now? And so really, it's really important to, you know, acknowledge that historical bias, democratize the data so that everybody's looking at it, and then pull out what it's telling us in as clear and fair a way as we can, so that people can begin to see that this data really does speak to you. It's really there for you. And we are looking at it in a way to counteract some of these historical injustices rather than to perpetuate them, which is, again, where I think a lot of the distrust comes from.
Did you say quickly, did you say that this is data that you're assembling yourself? And if so, I do want to ask quickly, do you see a need, particularly acutely now, that city councilors, city governments need more and better data and data visualization and new tools to communicate that with the public? That was very much a leading question, but I'm really specifically curious about, you know, I think we've seen a lot of researchers taking the lead. Certainly John Levy in our School of Public Health and others have been taking the lead on communicating data, assembling and reanalyzing data that the state and the city are putting out to try to identify some of these nuances, particularly with disproportionate impacts to communities of color. And it just feels like there's this big thing, there's this big unit missing in government, not just of analyzing the data, but also presenting it in a way and communicating it in a way that people can make sense of it. I think that's true on the climate side. It feels true, very true now on the COVID side. I'm curious, what's your opinion on the way in which cities in the future need to better aggregate, analyze, and communicate data to the public?
So my opinion is that they shouldn't be doing that. What I want from the city is to publish all the data, make it downloadable, give me access so that I can do my own analysis, you can do your own analysis, and by democratizing it and making it accessible and available to people, we actually enhance trust. If we say, you know, let the government analyze the data and tell us what's going on, people are inherently distrustful. And then if any bias starts seeping through that analysis and people pick up on that, not necessarily consciously, but they just look at it and go, yeah, this isn't really talking about me, that could actually make it worse. So the more we democratize it, the more we make it available to people, you know, like myself and anyone else who has the skills and the interest to say, what is this data telling me? And I can look at it through my own bias lens, and you can look at it through yours. And hopefully the more people are looking at it and presenting it back to the public, the more we can draw our own conclusions and come to better conclusions than if we're only seeing it through a particular lens.
Great. Thank you. I wish I could drill deeper on that point, but I'm going to get to some of the other questions in here. Can you, Rachel, can you help us understand, because the C40 community is so focused on peer-to-peer communication, but I'm also going to use the phrase peer pressure. What are some of the ways that you're seeing perhaps your members who are maybe more reluctant and need to sort of come along with the sort of hard chargers on the climate front? What are some of the ways that you are seeing the member network really maintain its focus on climate change and again, bring along some of those communities who are maybe slower to act? And then in particular, folks, Kim Barrett wanted to know about how we can encourage those who come to work to use public transportation and mass transit. And that's a good question I'd love to have you respond to from the C40. How are you guys seeing your members sort of double down on and prioritize mass transit in an era of anxiety?
Yes, absolutely. Okay, so the peer-to-peer, the peer pressure, yeah, we see that all the time. It's great, especially with men. I call it, someone at once called it co-opetition, so a kind of really nice blend of cooperating and competing, and we do see that a lot. At the moment, the ways that we're seeing them kind of work together, and it is more collaborative at the moment. They're really in a place of kind of huge crisis, and the ability to be able to kind of speak with other mayors and have that kind of peer support is phenomenal at the moment for them, and they kind of say that directly. And then hearing, I think what they do then is create a shared narrative. So the peer pressure piece we see a lot in the climate world. You know, we'll have an event somewhere and one of our mayors will come back going, I want that. This city's doing it, I want it as well. So we see that all the time, but at the moment what we're seeing is more kind of support and collaboration, and when they're really kind of in it, facing a big crisis, how they can share. And we've seen very practical examples of that. So some of the Chinese cities that were coming out of the crisis offered support through our network to other cities to sort of fly in a team of medical experts to help with equipment. So there's a real sense of solidarity, and we're seeing global north mayors who are ahead in terms of COVID hitting, you know, really standing firm about the need to support sister cities in the global south. So we're seeing just at the moment so much around collaboration and support. And one of the ways I think, another really specific example that I found very powerful was one of our mayors talking about the fact that if she can talk about an example from another city where this is happening and it's working, and she can show that to her citizens, then it makes it real. And that's a very powerful way to kind of convince people and create change by sort of saying, look, it's possible. This city's already doing it and has been for X number of years. Mm-hmm. Then you asked about public transport and mass transit. Yeah, huge challenge, as I said earlier. So our cities are rapidly sharing best practices on how to make transit safe, but you know, we're all working COVID out at the moment. So no one's got the definitive answer on that. And what cities have found is that there wasn't any guidance because COVID is an unprecedented situation. So they've really had to kind of innovate collectively in real time. So at the moment, we're just doing the best that we can in terms of the best practice for sanitization of transit systems, increasing frequency so that people can maintain distance whilst traveling by transport. We've heard several experiences of cities kind of reducing transport under lockdown and then realizing that the remaining key workers that still had to use it were really packed in. So then they increased the services again. Tech's been mentioned a lot. How can we use data to optimize the transport system? Auckland developed an app so that you can see how many people are on the bus and whether you can get on it and still maintain a distance. And then I guess the last thing just to mention about public transport and mass transit is that we really need to remember it's a public good. There's possibly one public transport system in the world that funds itself. All of the others are subsidized, generally heavily by national government. Sweeping statement, but yeah, as a general rule. And you know, we need to invest in our transport systems now, or they're going to be very badly damaged. You know, we're seeing revenues absolutely decimated, and yeah, we need to make them safe and then convince the public that they are safe, because it's the actual safety and the perception of safety that's important. And otherwise, you know, what we saw after the similar sort of outbreaks in East Asia is that the private vehicle use did increase afterwards and stayed higher, and public transport use and ridership went down, obviously dramatically, but then never fully recovered. So we're seeing that again happening now. So it is a big challenge.
Right. And so I think I've seen some cities, right, like London, working with employers to try to stagger work hours as well, to try to shift or sort of stretch out the typical sort of you know, congestion rush in the morning and the end of the day. For those, by the way, who aren't aware of it, you can look at NACDO. I think it's NACDO.org, National Association of City Transportation Officials, and they have a really comprehensive database of city level transportation related actions that cities have introduced in the context of COVID. And it includes things, right, rear boarding, increasing service frequency, getting rid of fees, actually making transit free in some instances to minimize contact with drivers, things like that. So these are great questions. So I want to close by asking each of you there are some more questions in here. but I want to be cognizant of time. So there's one question in here from Kathy that I want to try to get in, which is, what role does stakeholder engagement and science communication play in your programs? What do you see as new or most promising approaches for using engagement and communication as a means of improving public trust in data and science? So I guess the question here is whether you have, I'll summarize that. Are there one or two lessons you have learned along the way about how to effectively communicate science and data to the general public? And this is a 1-minute answer, because I have one other closing question for each of you. I'm going to start with you, Newsha.
Yeah, that's a great question. And I don't know if actually we've entirely figured it out yet. So I don't know if I would give any advice, but it's something that we spend a lot of time doing and thinking about, is that communication piece. And, you know, we very decidedly as a company, as an urban tech startup, wanted to take a very different approach from like the Ubers of the world that sort of came in against regulation and sort of asked for did what they wanted to do and asked for forgiveness later and figured it out. We are very actively working with government and with and helping the government communicate with the general public to figure out how to deploy this in a way that is comfortable for everybody, address any sort of privacy issues or questions that come up. And so, you know, we're looking for the answer for, you know, what are those like best practices ourselves. That's just, you know, it's a huge area for us, a huge area of focus.
Great. Quinton, are there 1 to 2 lessons you've learned in your prior life or your role now as an elected official about how to effectively communicate science and data with the public?
Well, one of the things I learned early on was to use simple language. And I've come to both hate and love Twitter. I hate Twitter because it's just absolutely horrid to try to communicate through that straw. But the good thing about it is that it really forces you to think about what are those essential nuggets that you're trying to communicate, and how do you share them in a way that is understandable to the greatest number of people. So it does force you to be on your toes.
Great. Rachel?
Yeah, in terms of how to effectively communicate science, I think stories and examples, so that people can emotionally engage and actually see it. And then I also think tools as a way for people to really engage with the data we see as very effective. They can run scenarios. And I mean, now I'm not talking about the general public, I'm talking about city officials, but also, you know, really great example from New York, for example, when they were doing their clean heat program and they wanted to engage a range of stakeholders around bringing in some fairly ambitious policies to reduce the low-grade heating oil use. And to get everyone on board, they just had a tool and they said, okay, let's have a look. If we don't do this till 10 years down the line, what does that mean? And that really helped people kind of properly engage with the conversation and feels a good way of using kind of data and I mean science to sort of really help make those decisions in real time.
Yeah, no, I think that's, we talked about transparency, we talked about letting people sort of play with the data and dig into it on their own. We talked about narrative and storytelling and sort of the human interest, and we also talked about privacy and the way in which privacy is being protected when needed. Pam, do I have time for one more question, or do you want me to turn it back over to you? One more question. Okay, one more. So again, last one, rapid fire question for each of you. Rachel, I see you, so I'm going to start with you. You had the benefit of working with Lindsay Butler. Others, you know, Newsha, you've worked, and Quinton, you will be working with the urban students, and I would love for you to comment in your closing remarks, what makes a good partner, particularly when you're working with a research partner, but just generally characteristics, what makes a good partner?
Well, I think Lindsay was an absolutely model one in all aspects. We work quite hard to find a good fit. So I think shared kind of goals, good overlap, otherwise that you're on a hiding to nothing. And then someone you can trust, who's going to deliver, and who's also going to not just do what you ask, but question and interrogate it, and bring for us the expertise that Lindsay brought was brilliant.
Quinton, what makes a good partner, particularly a research partner?
Right. I just recently, someone volunteered their services, and I sent them, and the answers were just perfect. And what made them perfect to me was that, again, they used simple language. They didn't assume that I was dumb, but they correctly assumed that I hadn't read all the papers that informed the answer. And so they took their time to explain that, gave me all the references to the original papers if I wanted to go dig into them myself. And then, as Rachel said, really anticipate some of the follow-up questions and think about, what's this person really asking, right? Because I may not have formulated the question completely originally. So, really trying to anticipate that and then understand that as a government official, we're not scientists. And so when we ask a question, it's not one scientist to another, it's a layperson asking a scientist, and the answer that comes back has to be digestible and understandable and actionable for us.
Great. And Newsha?
Yeah.
Last word.
Great question. Unfortunately, I was the one that probably worked the least with David on our team, since I focus on our government affairs and business development side of everything. But it's been a great relationship, and I think some of the things that are very important is definitely somebody who is very passionate about both the subject matter, but also finds the work technically interesting and exciting. And I think our team, at least our founding, first 5 individuals at the company, were all straight from academia. And so we can really appreciate the fact that the work also needs to be technically engaging and exciting for the partner. So, it's not just on the partners that research partners' openness to come in and do good work, but it's also, I think, on us to provide something that is engaging and exciting. And then I think just curiosity and alignment on the subject matter. Once you have all of those pieces in place, I think it's a great relationship.
Yeah, great. Well, everyone, please join me in thanking Newsha and Rachel and Quinton. This was a wonderful conversation, and I wish we had far more time. Thank you, everyone. And Pam, I will turn it back over to you.
Wonderful. Well, thank you so much. We really appreciate all of your time. And Newsha, Rachel, and Quinton, so glad you guys can join us. Thank you to Luca and Raquel for kicking us off, and Katharine for moderating this last portion. I also want to make sure that all of you hear a public thank you to Evan Curas, our program manager for the Urban program. He is everything behind the scenes, making everything happen, and it's just wonderful. And if you stick around for the breakout groups, he's going to be leading that session.